Nick, today I'll be doing an examination of your heart.
Sure.
So first thing I'll do is have you lay down on your back with your face up. Good. And so the first thing I'm going to do is just do a general exam. Can I see your hands, please? So I'm looking at your nails. I'm also looking at your hands for any cyanosis or pitting of the nails. Anything that would tell me that there's not circulation to that area. So the next part of this, I'm going to look at your chest. I'm going to watch your heartbeat. And I'm looking for any areas where the heartbeat should not be seen, like a xiphoid heartbeat, any pulsation there, or an epigastric heartbeat, which is also something I don't want to see. Okay. The next part of this would be the jugular venous pulsation test. So I will grab that for you real quick. So this is the jugular venous pressure test, and I'm going to have you up at a 45-degree angle. And then turn your head to the left. Good. And I'm going to look for the point of highest distension of the jugular vein. And I see it right here, so I'm going to mark that with my ruler. And I'm going to come down at a perpendicular angle with this tongue depressor. And I'm looking to see where that intersects vertically. So I've got my ruler here from that point, and we're within 2 to 3 centimeters, which is what we want to see. So that's good. The next part of this is I'm going to identify your apical pulse. So I'm looking right here, and it looks to me like it is right here. And I'm going to check with the pen light to verify that. And that looks good. That's where I want to see that apical pulse. Awesome. So the next part of this, Nick, is I'm going to palpate. I'm looking for the point of maximum intensity, which is just where your heartbeat is the strongest and where you can see the most visibility of your chest expanding. Sorry if my hands are cold, so I'm just palpating along here on the left side of the sternum. Good. And I'm feeling that maximum point of intensity on the right ventricle, right by the tricuspid. Awesome. Alright, so the next part of our examination for palpation is I'm going to be feeling for lifts and heaves, which would mean with my hands I'm going to feel extra movement on these areas, which we don't want to see. So I want them to be normal, in the same rhythm, and if I feel with my hands that your chest is jumping up, as it should, in any of these locations, that's what I'm concerned about. Good. But over here we got pulmonary, aortic, we have herbs, tricuspid, and mitral. Good. And then in none of those locations do I feel any of that. The next part of this is I'm going to look for heaves. So with my hands again, I'm going to use a bony contact like the hypothenar, and I'm looking for vibrations through my hands which would tell me there are heaves there. Or in other words, a murmur. So we'll go tricuspid, mitral, semilunar, aortic. Good. And there are no heaves there, so there are no murmurs. The next part of this is I'm going to have you sit up and face that way. I'm going to do percussion of the heart borders, okay? So I'm going to go along the 3rd, 4th, and 5th intercostal spaces, going from lateral to medial, looking for the border of your heart, okay? Can you kind of sit up straight for me? Yep. And I'm showing you on that side, but we are going to do it right here. Like I said, from lateral to medial, so the camera can see. Same thing, the armpit. Awesome. Great. Thank you. So the next part of this is auscultation, so I'm going to grab my stethoscope real quick. Okay. Alright. And with the diaphragm of my stethoscope, I'm going to go into aortic and pulmonary, herbs, tricuspid, and mitral, okay? And I'll just have you breathe normally every time I place this, okay? next part of auscultation is I'm going to use the bell of the diaphragm and just go in the opposite order, okay? And what I'm looking for with these tests is any kind of splitting of the S2, which is the second part of your heartbeat, the dub, lub dub. I'm also looking for S3, which would be a second sound after the S2, or an L or S4, which is before S1. So I'm just checking to make sure I don't hear any of that. And that seemed all normal to me. I didn't hear any murmur for splitting that, so that's what we want to see. Alright, I'll put the stethoscope away, and the next part of this is aortic regurgitation. Actually, I need that one more time, don't I? I'm going to continue this for our special test. So I want you to just take a deep breath, okay? And I want you to hold it when I tell you to. And I'm going to be looking for that second heart sound, okay? Go ahead and take a deep breath in. Let it out. And hold it. So what I was doing is making sure that that second heart sound was there. So the lub dub, and the positive for aortic regurgitation would be more of a lub, like pew pew pew, something kind of weak, but it was normal. And so the next thing we're going to do is mitral valve enhancement and mitral valve murmur. So the first one, I'm going to have you take a deep breath in again and let it out and just hold it, okay? Okay, go ahead and do that. Deep breath in, let it out, and hold it. Awesome. And then we're going to do the murmur next, so I'll have you take a deep breath in and just bear down. Going to the bathroom or blowing up the balloon or something like that. Okay, go ahead and do that. Hold it in. Hold it. Okay. So I was just looking for murmurs, and I was also looking for enhancement when you're holding your breath. But that was all normal. So I want to see. And that concludes our test today. Thank you.
Thank you.